A storm gathers as we take the turn off a patch road to Teuriang village, Nambieso sub-county in Kwania. It is dusk. Lightning flickers ahead, illuminating the rough road in flashes. It's raining where we are headed. Hello and welcome to the New Vision Daily podcast around Uganda. And today we bring you the children malaria is taking in Lango. I'm Razia Asman. In the vehicle with us is 27-year-old Kela Obura, who has just buried a child she lost to malaria. As we navigate the bushy, dark road, her mood changes. She grows quiet, lost in memory. Soon she is moved to tears. Obura's voice trembles as she points to the final turn to her father's home, where her son, Kicharwot Timothy, was laid to rest. The journey from Lira city has taken 2 hours. Dr. Jimmy Alal, a medical officer at Lira Regional Referral Hospital in pediatrics, has come with us. He helps translate our conversation. His voice is calm but heavy with empathy. It's all emotional.
When you rush the child to health centers, there is sometimes delay. She says the health worker do not respond quickly, much as you're saying the baby is not well. Sometimes they delay to support them. And the aspect of medications, that when they are prescribed for medicine at the facility, they were unable to.
Obura narrates how it began. Her son was weak, feverish, and not eating. This was where they lived along the shores of Lake Kwania. She struggled to find 15,000 shillings to reach Nambieso Health Center 3. Kicharwot was diagnosed with malaria, but his condition worsened within 2 days. They were referred to Aduku Health Center 4, where transport cost 25,000 shillings by Boda Boda. With no money and her father, Henry Okonye, a subsistence farmer, they borrowed the money. The health center could not manage the case. He was referred to Lira Regional Referral Hospital. There, Dr. Alal and the team took over treatment, but it was too late. Complications had set in. On March 24th, 2026, 4-year-old Kicharwot Timothy was pronounced dead.
This child came in a very critical condition. The child presented with fever that was high grade, with associated multiple complications, was vomiting, unable to feed. And then we received the child, evaluated, and investigated the child. The child was previously treated for malaria right away from the health center that is nearby here.
Kicharwot's story is not isolated. Many families in Lango are facing the same threat. Some are already in the fight for survival. At Lira Regional Referral Hospital, cries of babies and young children fill the air. It's 1 p.m. The numbers keep rising, mostly mothers carrying sick children. Records are taken at the acute unit of the outpatient department. Robson Okabo, the principal medical clinical officer, says,
if it means even carrying the baby, you will carry the baby and the mother follows you, so that the baby reaches the ward immediately and started on treatment immediately. The treatment may involve oxygen administration. It may involve IV, artesunate, no longer oral. Of course, this one cannot swallow at that point. That means all treatment now will have to be through the veins. So it should be started immediately.
The waiting area is full. Some people stand, others lean against the walls. A mother breastfeeds weak twins, one on each side as she waits. Names are called over a loudspeaker. Patients move from records to triage. to clinic, to laboratory, and finally treatment. Okapu says those in severe condition are rushed to emergency and admitted, but not all arrive in time. Some, like Kicharwot Timothy, come when the illness is already advanced. Most children arriving here are battling severe malaria. The facility recorded 2,437 malaria cases at the outpatient department between October and December 2025. Dr. Andrew Odur, the director of Lira Regional Referral Hospital, says
the spike came around March now, April, when the rains are up there, and we registered an increase of more than 15% in the cases that came to the regional referral. But of course, among the people who are dying is mainly in the children under 5 because of the severe forms of the malaria. And sometimes because of identifying the problem late, and then they are coming here. So among those that are admitted with malaria, we will have mortality up to 5%, and majority of the 5% are those that have come from the lower facilities and late.
When malaria does not take a life, it takes quality of life. By the time many patients are diagnosed, complications have already begun. Doctors explain that in severe cases, malaria parasites destroy red blood cells and block small blood vessels. This reduces oxygen supply to vital organs. The kidneys, brain, and lungs are most affected. This leads to acute kidney injury, cerebral malaria, and breathing difficulties.
The aggressive form of malaria, the cerebral malaria, unlike the ones in other East African countries.
A review of malaria-associated acute kidney injury in African children found that 24 to 59% of severe cases develop kidney injury. 5-year-old Marceline Ayonge from Lira had not passed urine for a week. Her condition required dialysis to survive. Her mother, Rebecca Adimo, could not afford treatment locally. She was referred to St. Mary's Hospital, Lacho, for the affordable peritoneal dialysis.
We keep our children out of mosquito for proper medication and proper care, for them to be our future mothers and future generation that we are building them for. That is my only advice, and I'm not scared of anything at all. My girl has fully recovered and she's okay.
A recent JAMA study in Uganda has linked severe malaria in childhood to long-term cognitive and academic challenges. Dr. Daniel Ogwal, a medical officer at Lira Regional Referral Hospital, is part of a study tracking children with severe malaria. The research follows them over 2 years to assess long-term kidney outcomes.
Some die before reaching the hospital, but then others develop other complications that can affect the quality of life after this illness. So the study is looking mainly at how does this affect their kidneys, and how many of them develop acute kidney injury, and then also over a period of 2 years, how many develop chronic kidney disease, but then also looks at the health-related quality of life.
Some are treated as outpatients, others are admitted, and some children die before reaching hospital. At the Lira site, 26 of 200 sampled patients died. Dr. Andrew Odur says
The challenge still remains that we need to continue to reduce the burden, and most of the children who die from malaria usually because of severe anemia that has developed because of severe malaria, and some of them are actually getting acute kidney injury where their kidneys are knocked off, and thanks to dialysis which we have here, we are able to give them the treatment and take them through dialysis, and their kidneys recover. And mind you, these are children. And as a hospital here, we tend to prioritize and support them because their kidneys can easily recover and regain its functionality.
Despite understanding what malaria does inside the body, prevention remains a challenge. Dr. Alal helped us when our car battery died. It was past 9 p.m. in Nambieso after visiting Kicharwot's burial site. He rode off on a bicycle, found a battery and returned.
Oh, so that they removed this. They had visitors when they were doing burial. They had to pick all the new ones, open them out so that visitors can use. Yeah.
He told us he was doing a lot of field work before becoming a medical officer. The government has launched several interventions. The Malaria Elimination Strategy 2025 to 2030 aims for 80% coverage of prevention tools. This includes distribution of 25.8 million insecticide-treated nets. The 24.2 hours initiative aims to ensure patients are tested and treated within 24 hours and within 2 hours of reaching a clinic. Dr. Jane Irene Nabakoza of the Ministry of Health says,
in case anyone is notified that there is a severe malaria patient in a retreat or anywhere, in any part of that catchment area, they are able to pick that patient as a priority, straight to the point where they receive care.
Between 2009 and 2018-2019, malaria prevalence in children under 5 dropped from 42% to 9%, but new data shows a reversal. Prevalence has risen to 21%. In Lango, it reaches 59%. Even with existing interventions, malaria persists. This has pushed researchers to explore new tools. Dr. Martin Lukindu of Target Malaria says,
most people fear that if we bring in novel tools, like genetic control tools, they are going to wipe out all mosquitoes. No, it's only those few species that have the capability to bite you and transmit malaria to you.
Target Malaria is part of an international research consortium developing gene-drive mosquitoes. These aim to reduce mosquito populations that spread malaria. If successful, it may be included in the national strategy. Dr. Jonathan Kayondo, the principal investigator at the Uganda Virus Research Institute, explains,
we are probably maybe 6-7 years away if everything goes well before we can say we have a tool that will have been, field demonstrated to be efficacious. So it's still some time. We still have some ways to go, but that's also being very optimistic because it takes lots of time, lots of regulation, because this kind of technology and everything genetically modified requires, regulatory oversight, and for good reasons.
Gene drive increases the likelihood of a trait being passed to future generations. It's being studied as a complementary tool alongside nets, drugs, and vaccines. No gene drive mosquitoes have been released in Uganda. Trials are hoped for by 2030. Until then, communities like Teoriang remain wary. Kicharwot's grandfather shows 5 mosquito nets. They are worn and dirty. He jokes that Nambieso was once chosen for development, but too many mosquitoes changed that plan. While future tools are still years away, the burden today is most visible in Apache. The image of Obura and her father at her son's grave at night remains. Mosquitoes are ordinary insects, but deadly vectors. Apache and the wider Lango sub-region carry some of the highest malaria burden in Uganda. Dr. James Daniel Odongo, the district health officer, says children under 5 are most affected. In 2024-2025, the district recorded 3,441 cases. In 2025-2026, 1,803 cases. He says the decline reflects progress, but malaria remains rooted. Apache has also introduced malaria vaccination. About 2,255 children have received the vaccine, with coverage estimated at 79%.
We empower our people with knowledge on prevention and control, such that stagnant waters, broken slates, basins that collect rainwater, that provide good breeding places for mosquito multiplication are destroyed.
Target malaria researchers are working to reduce the population of malaria mosquitoes because fewer mosquitoes carrying malaria would mean stopping the transmission of the disease. Between 2009 and 2018-2019, the country reduced malaria prevalence among children under 5 from 42% to 9%. The progress is driven also by residual spraying, but new data from the 2024-2025 Malaria Indicator Survey by Uganda Bureau of Statistics shows a worrying reversal. Prevalence has risen to 21%. In some regions, the situation is even more severe, reaching 59% in Lango, 46% in Acholi, and 44% in Teso. And in Teoriang Nambieso, Kela Oburo still visits a small grave beside her father's compound. This reporting was produced with support from Target Malaria. You've been listening to The Children Malaria is Taking in Lango. My name is Razia Othman.